I apologize for asking people to move to their seats, but we have a wonderful but fairly tight agenda this morning. My name is Bill Beardslee. I'm from Children's Hospital in Boston and with the IOM, and I'm co-chairing this forum along with Hendricks Brown. I am thrilled to be here. I think the topic of how we move from knowing what helps children to being able to implement those kinds of activities widely such that we can have a population-level impact is absolutely crucial. That's the focus of what we're talking about today. And I think two other concepts. I think in a democracy, we need to be sure that everyone receives access to the same high-quality care. In order to do that, we need to disseminate the best evidence-based treatments and preventions widely in multiple settings, adapt them for multiple cultures, and be able to measure outcomes. And I think secondly, very much our long-term goal has to be to have a population-level impact, to have an impact on everyone in the population. The kind of work I do is in the prevention of depression. In that regard, we want to actually lower the incidence of major depression in the population. That said, this is an extraordinary group of people that will be presenting over the next 2 days. I've been part of the planning conversations. I know many of the presenters. I'm enormously grateful that they've taken their time and come to this forum. And I think a second major point is it's not just the presentations, but perhaps even more importantly, the dialogue that we can have together with one another as we really try to think about moving the field of implementation and dissemination forward. I met with the committee a few minutes ago and I made the comment that David Hawkins, who is chairing this two-day forum, and I were on the Institute of Medicine committee that issued a report on prevention in '94, and Hendricks Brown and I and Tom Boat were on a committee that issued one in 2009. The key point is the science has moved an extraordinary amount in those years and has moved a great deal since 2009. We identified in 2009 the key challenge as being able to implement and disseminate preventions and treatments widely, and that's very much the focus of our work. So with that, I'll turn it over to Hendricks Brown. Welcome, and we look forward to talking with you throughout the 2 days.